I did my concept map on heart failure. I am going to start off by explaining the pathophysiology behind heart failure, which is high output failure, above normal cardiac output. High output failure is caused by severe anemia, which is a below normal amount of red blood cells, and thiamine deficiency. High output failure leads to an increase in the force of contractions by the heart, which leads to a weakened heart muscle, which leads to ventricular failure. Next, there is low output failure, which is caused by a decrease in venous return to the heart. Low output failure leads to a decrease in blood circulating through the heart, which leads to a decrease in oxygen and nutrients reaching your cells, which causes your cells to die. Next, there is left ventricular failure. Left ventricular failure leads to a decrease in perfusion of kidneys, which means a decrease in the passage of blood to the kidneys, which causes the stimulation of the renin-angiotensin-aldosterone system. Next, left ventricular failure can be separated into two categories, which are left ventricular diastolic dysfunction and left ventricular systolic dysfunction. Left ventricular diastolic dysfunction is caused by a decrease in relaxation of the left ventricle, which is caused by an increase in afterload. Afterload has to do with the amount of pressure the heart has to work against to pump blood. Next, there is left ventricular systolic dysfunction, which causes a weak left ventricle. This weak left ventricle is an issue because it can't pump an adequate amount of blood into the aorta, which leads to decrease in cardiac output and stroke volume. Cardiac output has to do with the amount of blood ejected by the heart in 1 minute, and stroke volume has to do with the amount of blood ejected by the heart during a contraction. Next, left ventricular systolic dysfunction can be separated into two categories as well. They are backward effect of failure and forward effect of failure. Backward effect of failure leads to an increase in hydrostatic pressure in the left atrium. Hydrostatic pressure has to do with the amount of pressure that is pushed against the capillaries, which causes fluids to leak out of the pores of the capillaries and into the interstitial space. This causes fluids to leak into interstitial space and leads to a number of clinical manifestations, which are crackles. It's a lung sound that you can hear with a stethoscope. It also leads to coughing, dyspnea, which is difficulty breathing, orthopnea, which is shortness of breath when lying down, and lastly, PND, which stands for paroxysmal nocturnal dyspnea, which is shortness of breath that interrupts your sleep. Next, the forward effect of failure, which is caused by left ventricular systolic dysfunction, leads to a decrease in the ejection of blood into the aorta, which leads to a decrease in perfusion. A decrease in perfusion can lead to stroke and then death. A decrease in perfusion can also lead to ischemic heart disease, which can lead to a decrease in oxygen and nutrients reaching your cells, which leads to your cells dying. So, a decrease in perfusion, so left ventricular systolic dysfunction is related to low output failure because both lead to your cells dying. due to both of them causing a decrease in oxygen and nutrients reaching your cells. So that is a connection between two pathophysiology topics. Again, it's left ventricular systolic dysfunction and low output failure that are related. Next, a decrease in perfusion can lead to stimulation of the renin-angiotensin-aldosterone system, ADH, which is antidiuretic hormone, and SNS, which is the sympathetic nervous system. So, left ventricular systolic, and actually, so we also mentioned before, I mentioned before that left ventricular failure leads to a decrease in perfusion, of kidneys, which stimulates the renin-angiotensin-aldosterone system. And now I am saying it again with a decrease in perfusion caused by a decrease in the ejection of blood into the aorta. So, when ADH is released, it causes an increase in water reabsorption, which increases blood volume, which increases blood pressure. When the sympathetic nervous system is activated, it causes an increase in heart rate and an increase in blood pressure. When the renin-angiotensin-aldosterone system is activated, it causes kidneys to release renin. So renin causes angiotensinogen to become angiotensin 1. And angiotensin 1, ACE, which stands for angiotensin converting enzyme, metabolizes angiotensin 1 into angiotensin 2. Next, there is right ventricular failure. So, with right ventricular failure, it causes edema, which is swelling. It also causes a decrease in contractile force into the pulmonary arteries. And this causes a decrease in oxygen diffusion in alveoli, which leads to hypoxemia, which is a low amount of oxygen in your blood. So next, there is diastolic dysfunction. Diastolic dysfunction leads to a stiff left ventricle. So diastolic dysfunction is insufficient relaxation of the heart. It leads to stiff left ventricle that cannot fill up with adequate amount of blood. This leads to a decrease in blood volume in the left ventricle. This leads to low cardiac output and stroke volume. So, diastolic dysfunction is related to systolic dysfunction because both lead to a decrease in cardiac output and stroke volume. Next, there is systolic dysfunction, which is an insufficient contraction of the heart. It leads to a decrease in cardiac output and stroke volume, which leads to blood accumulating in the left ventricle. This causes an increase in pressure in the left ventricle. Then a backup of hydrostatic pressure, which is the amount of pressure exerted against the capillary walls that causes fluid to leak. So it causes that. And then so now I explained all the topics, the pathophysiology topics related to heart failure. Now I am going to explain the etiology, or what causes heart failure. So one of the causes of heart failure is COPD, which is chronic obstructive pulmonary disease. This leads to constriction of pulmonary arterial vessels in the lungs, which leads to pulmonary hypertension. Pulmonary hypertension leads to an overworked right ventricle, which leads to left ventricular failure. And left ventricular failure is also known as heart failure. Next, pulmonary hypertension can lead to right ventricular failure. And I mentioned those steps already. Right ventricular failure can, in the end, lead to left ventricular failure. Okay, so next, another etiology of heart failure is myocardial infarction or heart attacks. Myocardial infarctions can lead to cardiogenic shock, which is when the heart can't pump enough blood. This leads to a decrease in blood pressure and leads to organ failure. Also, when you have a decrease in blood pressure, the renin-angiotensin-aldosterone system is activated to increase blood pressure. So, the etiology of so when you have a myocardial infarction, which is an etiology, it is also related to the pathophysiology of left ventricular failure, because left ventricular failure causes a stimulation of the renin-angiotensin-aldosterone system, and myocardial infarctions are also related to the pathophysiology of systolic dysfunction. Next, I am going to explain complications of heart failure. So, there's also another etiology related to heart failure. It is coronary artery disease. So, this causes cardiomegaly, which is an enlarged heart. This enlarged heart can lead to myocardial infarctions. Next, I am going to talk about the risk factors of heart failure. So the first risk factor is kidney problems, such as lupus nephritis. This leads to an increase in blood volume, which leads to an increase in blood pressure. This causes an increased workload for the heart, which leads to weakened heart muscle, which leads to ventricular failure. Next, the other risk factor is ethnicity. African Americans have an increased risk of acquiring heart failure. And the reason why is because African Americans are actually also at an increased risk of developing hypertension. And hypertension leads to left ventricular systolic dysfunction, which is caused by left ventricular failure. So that's why they are at an increased risk of acquiring heart failure, because they are also at an increased risk of acquiring hypertension. Next risk factor is obesity. Obesity leads to hypertension. Well, it can, people that are obese have an increased risk of acquiring hypertension. And then I mentioned what hypertension does. It leads to left ventricular systolic dysfunction, which is caused by left ventricular failure, and left ventricular systolic dysfunction leads to a decrease in cardiac output and stroke volume. Another risk factor is alcohol abuse, because alcohol abuse leads to hypertension. And I mentioned what hypertension does. Obesity also puts you at an increased risk of acquiring diabetes. Okay, so I am going to make a part 2 because my battery for my camera is dying. So I will explain the rest in part 2